5 cases of the Zika virus have now been confirmed in the British Virgin Islands. The Ministry of Health and Social Development said the cases were contracted in the Cane Garden Bay and Havers areas of Tortola. 3 of the cases were tested locally and found to be positive, and the other 2 were tested overseas. Medical Officer of Health, Dr. Ronald Georges, stated that with neighboring islands contracting the virus, it was only a matter of time for the British Virgin Islands to confirm cases. Dr. Georges further stated that public health has been working very closely with the Environmental Health Division to address what he called the hot zones for the Zika virus. Residents, in the meantime, are urged to be vigilant in inspecting their premises for mosquito breeding sites.
Over the last couple of weeks, we've had lots of people complaining of symptoms, with fever, rashes, that fit the symptom profile of Zika, chikungunya, etc. And today we were able to get 3 cases confirmed from a local private facility, persons who they had seen and who had Zika PCR testing, which is a very sensitive test for Zika, and they were able to confirm 3 cases. We've also had 2 persons subsequent to being in the territory, travel overseas, develop symptoms, and also had Zika PCR testing done, and that was positive. So all in all, we have 3 cases of persons locally and 2 persons who were in the territory who subsequently were tested positive. So that's 5 in all.
JTV News spoke to Dr. Michelle Penn of Penn's Medical Clinic about the Zika virus.
School is just about to be open. Summer is over. Students are now getting back into the classrooms. You don't want children to be out of school because of illness. The Environmental Health Division, the Rotary clubs have been preaching about putting the guppies into the hands of school children. They can take them home and put them into their systems to help to limit what is taking place. I hope to see that collaboration happening in the next few weeks so that we can get this whole thing behind us.
He explained that symptoms of the Zika virus are similar to those of chikungunya and dengue fever. Symptoms include rash, joint pain, fever, and eye infection known as conjunctivitis or pink eye.
There's a lot of alarm, there's a lot of tourism restrictions on traveling. The Olympics has had a major issue, whether a person will go to the Olympics because Zika is in the Olympics. I'm sure everyone coming back from the Olympics are not coming back sick with a condition that cannot be controlled. So we realize that the alarm is coming from somewhere. I'm not sure where it's coming from. But what we're saying is that the conditions are so similar. The alarm may be outside of what is reasonable. The symptoms that you're seeing are symptoms that can be controlled with very basic medications. Fever, rash, those can be controlled very easily. The only thing we're concerned about is whether we have Aedes aegypti bringing us hemorrhagic dengue, which makes people have internal bleeding and those other challenges. Now that's where, looking at these mosquito-borne illnesses, we don't want to miss those because those are the ones that actually will cause fatalities. But on its own, I'm not aware of a single fatality in our zone from the mosquito-borne illness in this season. But again, we don't want to keep having mosquito-borne diseases. Now it is Zika, tomorrow it is something else. Tomorrow it's type 5 of something else. We want to be able to get rid of the vector. Clearly it's a challenge for us in the jurisdiction.